It's like 3, 2, 1, and then they hit it together. I don't know.
I think so. Nobody's trusted.
We haven't seen it.
Yeah.
We're probably safe.
Been kind of working in the background. We had some donations. We got $100,000 donation, we got a $50,000 donation, and several other smaller ones. So, we've secured the dollars we needed to match the grant.
Did you check the gallery for rotten fruit?
Just coming up in the grant season.
I don't want to see any tomatoes or old cabbages come flying up there.
Still not enough. Thanks, Don.
I mean, it'll be a while before we go build cabins and stuff like that. But we'll have expanded campground next year. Assuming that I get all the I's dotted, and the T's crossed on this grant, this federal grant that we got. But
So how many more spots would that open?
plan is for 18. So it's still kind of a tentative plan. We've got to work within our system capacity, with the water system and stuff, but so it'll be about a 50% expansion.
You're just good at
It's
6
a
more
busy
inches,
season. Yes, sir.
then it will come on to Brian's head.
Put it in front of me.
So that's good.
It should definitely get
Yeah,
priority.
we're busy enough. We've already sold out. Weeks.
So look, I was going for.
You're out.
Yeah.
You're looking patriotic.
Well, thank you all for coming. We appreciate you taking the time out of your busy schedules. We are recording it. And it will be on our website after, and last time the Hawkeye put it on their website too, so. There's no press in the room, but they usually do watch it later. Just so you know.
But it's not on vibrate.
I just turned that off. It's a new phone. I don't know how to make that stuff.
Mine's on vibrate.
Work that tech.
Vibrate, yep.
Got airplane mode.
But it's
You
just
turn it on?
distracting though.
Way to go, Shane.
Hit that airplane.
Ever sit in a movie and somebody's phone go off?
I was so hard.
The return of it.
Yeah.
Yeah. Front of you.
Okay, avoid long speeches. We want to be out of here by 9. Shane.
I thought you were looking at Tom during that. I'm offended, Rachel, but not really.
Go in a minute in and out. Your microphones are live and I'm gonna start letting people in the waiting room because we're waiting. So.
Probably set records for the crowd.
Yeah. The county YouTube channel still, I'm a little disappointed. It hasn't got us into the revenue generating
Yeah,
level yet.
you could have probably sold ads for this.
Maybe you need better content. Adam?
I don't think there's any doubt about that.
That's pretty harsh, but I suspect that has something to do with it. We're looking to break into double figures.
Ooh.
I didn't include it on there, but if you want to talk about home rule. Yeah. That-
I guess I can define it, but that's about it.
Or how it would affect your budget if there's not local control. That will be a question if nobody else has questions, but I think Chad will ask it.
You need to turn that off.
I tried.
Oh, you can't.
It's like on 0, we turned off the, it's like, yeah, I don't, it's very distracting.
can hear well enough to, right?
I don't know what it is. We
Yeah,
turned,
okay.
it's been on and off in the closet. We turned down the volume, so.
No problem.
All right, we can go.
Good morning and welcome to a new season of Friday Forums, formerly known as Eggs and Issues. My name is Steve Francis with First Interstate Bank, a member of the Government Relations Committee, and I will be your moderator this morning. I would like to thank the Partnerships Government Relations Committee for hosting this event. This month, we will be featuring Des Moines County leadership. With us today, we have Des Moines County Supervisors, Tom Broker, Shane McCampbell, Krista Poggemiller with Des Moines County Public Health, Chris Lee with Des Moines County Conservation, and Brian Carter with the Des Moines County Engineers. We will begin with starter questions to hit some timely topics. We then open the floor to questions To online viewers, please submit your questions via the chat option. This is designed to be a question and answer format, so try to avoid long speeches. And this first question goes out for everybody, and we'll start with you, Krista. What are your top 3 goals for next year?
Obviously, one of the things that we're looking at is the new public health building. So we're working through the architectural process right now. And so hope to eventually get that out for construction bidding. And then hopefully sometime by the end of this year, possibly move into the building. And we continue also to have our community health needs assessment that we work through. And so we've got some goals for the community, such as working on things like nutritious meals for the community and diabetes, providing resources for the things such as mental health and substance abuse.
Thank you. Brian?
Well, as you could suspect, projects are 2 of my top 3. So we are in the middle of replacing a bridge in the early part of it on Highway 99. So getting that project and the bridge replaced, and then rolling into next year with the remainder of the project, getting that all completed. So that's one of our big goals. Second one would be we're doing a fairly significant paving project down towards the Geode Quarry, Bridgeport Road. That's an early spring, kind of abnormal for us project. So getting that one wrapped up as timely in as timely a manner as possible is also important for us. And then the last goal, I guess, is probably pretty broad, but I think we're all dealing with it. Is I kind of wrote it out, but continue to evaluate impacts of inflation and basically closely monitor the ability to fund priority maintenance and construction projects. Just the dollar doesn't go as far, and it really does pinch when you're trying to do stuff that needs to be done.
Tom?
One of my goals is always maintaining the financial health of Des Moines County and our residents while providing first-rate essential county services. To follow up Brian a little bit, over the last 20 years, the state has transferred ownership and responsibility, gifted the county with several sections of highways 34, 79, 99, and 406. Some of the roadway surfaces and bridges on those highways will need repair or replacement in the next few years, complicating the issue with the limits that state law sets on secondary roads funding. So the county will need to find a way to complete this work without negatively impacting regular maintenance of our transportation system. And third, to piggyback on what Krista said, shepherding a new public health facility into existence.
Thank you. Chris?
Yeah, so for Des Moines County Conservation, our #1 goal is and always will be connecting people with the outdoors. And so as we go through this next year, we'll be working real hard to make sure that our parks are welcoming, that they're available, and that they're accessible. We have several big projects, and so I guess another goal would be to continue with the project plans that we have for Big Hollow Recreation Area. We have some accessibility improvements that we'd like to incorporate into that. We do have some grant funded projects coming up that we'll be implementing hopefully this next year, which includes an expanded campground and sidewalks for accessibility down to the lake, at the kayak launch dock, fishing jetty, and at the beach. And then we'd like to also make some progress on some sections of the Flint River Trail. That's probably not something that's going to see a lot of work in this next year, but there'll be a lot of background work on that, and then other grant programs to keep Big Hollow, with Flint River Trail, and some of our other areas moving forward.
Thank you. Shane?
Well, I'm gonna piggyback a little bit. Obviously, it's similar issues, but first I would like to move past, I think one of them is moving past the post-COVID relief repercussions. Anytime the government usually gives out money, we all know, in my experience anyways, if they give you $30,000, later on down the road, they're gonna end up taking 50,000. I see you looking at the clock. Are you timing me? They're gonna take 50,000. So I think making the adjustment, getting used to not having that money and making the adjustments, keeping the same services, I think that's going to be a priority. Also staying within budget with the health department. I really want to stay within that $3.5 million guideline that we established, because we're paying for that with ARPA dollars, and there's money that we could use left over from that building to do some other things I think is a necessity. The other thing for me is dialogue. I think we need to be more regionally minded moving forward. I think it's going to help us to get over some of the humps that a lot of communities are going to be experiencing here real soon. So I think having communication with the mayors on a one-on-one level and also as a group, I think that's going to help us so that we can make sure we're catering certain things towards certain areas that need it the most within Des Moines County. I'll stop there. I'll keep going.
Thanks, Shane. Next question is for you, Brian, and I think you've touched on a couple of parts of the infrastructure plan that the county has over a 5-year period. Could you tell us maybe some of the projects maybe you're wrapping up in the upcoming weeks, and what are some of the first projects to go in 2023?
Sure. Probably the biggest topic of conversation right now and centers around Highway 99, and Tom hit on it, and that's going to be a theme for the next 3 to 4 years. We currently are building a bridge. They've just started. If anybody's driven through there in the last month and a half, they've not been thrilled. It was a 1-lane traffic control. We did that over a closure, trying to keep the road open as much as possible. So you saw some grading get done. The bridge will get built through the winter. And so next year we'll roll into that, and we will have to close the road at that time because the new road it'll be realigned to where the new bridge is being built. So that is a major project for us. But I think there's some major safety improvements for vision in that area. If you ever pulled out in old Leo's location from Golf Course Road, it's pretty blind there. And one of our major goals there was to improve that sight distance. So that should be done. I mentioned the Bridgeport project earlier. It's a concrete project. It sits just on the north side of the geode quarry, which is one of the major quarries in our county. So we are starting that abnormally early. We're going to force that work to start in March, which for paving construction is very rare, but kind of trying to think outside the box to try to shrink the window of that road closure to impact local business as little as possible, I guess. And then I guess big picture, I mentioned the inflation side of things earlier. It's hitting us just as hard, if not harder than maybe some others. We are actively working on lining up funding for a couple bridge replacement projects. And yet again, one of them is again on Highway 99, the far north bridge. If you've gone up all the way to Pumping Station Road, you're crossed it. It's just before that. That is kind of the last bridge for us to deal with. Don't kid yourself. The state knew what they were doing when they give those roads away to the local communities. They didn't give us anything new. I look forward to tallying up the money we've spent on that road when we finally have touched every mile of it, because it will be a large number. And then I'll stay with that, with the bridge theme. Upper Flint Road, that's obviously a very busy road. We've repaved that entire road in the last few years, so it's in very good shape. The last thing we have to do is replace the bridge. And so there are some other bridge projects. I'm not going to go through the whole program because trust me, you'll lose people from this meeting, but that bridge needs to be replaced. So we're working on funding for both those bridges and then a couple others. Big picture, we're always big picture. I think no different than anybody else. We have a large, expensive resurfacing project we're working on. That would be the remainder of Highway 99. So all the way from the Burlington city limits clear up to Meeker's Landing Road, which is 11 miles, which might be the largest project we've ever done as far as an asphalt job. Working on the funding for that. I believe we've got that lined up, but at the same time, we need to address old Highway 34, back to the theme of roads that we were given from the DOT. So we're hoping to tie those together, but that's millions of dollars. So that takes a lot of time and planning. So those are kind of the high points. There are plenty others, and anybody that's interested could certainly give me a call and I'll walk them through the other details.
Thank you. Appreciate it. Next question. Housing is a top priority for our Chamber of Commerce members. The new housing needs assessment results will be available next month. What are you hoping to learn from the housing study, and how will you leverage the information? Start with you, Shane.
Well, first off, the median income in Des Moines County is $55,153. I think the standard operating procedure for buying a house is 30% of your gross monthly income for the Des Moines County, and that means they can only afford $100,000 or $1,375 a month for a house. So obviously, I do think that is a problem in Des Moines County, which I didn't see before. Prior, a couple of years ago, I said, well, I'm not sure if that even is a problem in Des Moines County. We would have to see. So I'm very curious to see what this comes out to be. As far as leveraging, I think we need to utilize systems that we have in place with CDBG grants, Section 8 home investment partnership programs, which are available. But again, back to my earlier point, I think what we can do is a lot of times when we've gone after money, there's been the same communities within Des Moines County trying to go after the same amount of money. And they're not going to usually give that pot out. So I think if we were more regionally minded and said, well, find out who needs it the most, who needs this piece of pie. I think those are areas where we can really start to leverage for Des Moines County as far as housing and start getting that situation handled.
Thank you. Tom, did you want to?
Sure. Of course, I answered this about a month ago here about my, I'm not a fan of housing subsidies, but I won't go into that. I'm not sure what we'll learn from the housing study, but I'll be interested in what it has to say. It should provide good information for local developers and will probably be used to create additional housing incentives and tax abatements. And most of those incentives will be at the state and city level. Des Moines County has not used those types of incentives in the past, and I don't see that for changing in the near future.
Thank you. Anybody else want to chime in on this topic? All right, we'll move to the next question then. Continued economic growth is key for Greater Burlington's success. What do you see as the greatest challenges facing business retention and expansion efforts? What role can the county government play in addressing these challenges? They will start, Tom.
In my opinion, workforce and the decline of energy generation capacity are probably the biggest current challenges. The most important economic role for the county is to promote the community's economic health by providing a well-managed county government with stable, competitive property tax rates, well-maintained transportation infrastructure, excellent, efficient county services. None of that's flashy, but it's essential. And in addition, the county's provided financial support for all three of the partnerships partnering for the future campaigns, and I think they're doing good work on the workforce issue.
Shane, would you like to add anything?
I think one of our biggest problems is competition. It's getting tougher and tougher to try to lure business and to also keep them in the area. So I was listening to I can't remember what the commercial was, but it was this morning on the way here. I think it was Sherwood. First impressions last. You know what I'm talking about? You guys
Yep.
All right. Well, anyways, it stuck with me, but I think that's an imperative. And I think we've missed out. And I know I have as a county supervisor, I've missed out on opportunities to really hammer in that first impression because they do last. And I think that's going to have to be a priority as well, because everybody can pretty much offer the same things. They're throwing out dollars and tax breaks and things of that nature. But I think we just need to make sure that we make a good first impression also and make it friendly for business when they come in, not have so many hoops that they have to jump through, just have it pretty straightforward how they can work within Des Moines County and how we're going to make it easy for them to stay here. So I think those are some of the things we can do. But the biggest problem I think that we're facing really is just the competition. It's just getting tougher and tougher to get that business to come in and take a look at you.
Thank you.
I add to that.
What's that?
May I add to that?
You bet.
So for at least my little niche within county government, within the parks and conservation world, we look at it from the perspective of when somebody's looking at moving to town, they're asking the question of where are they going to work, where are they going to live? And so workforce and housing obviously is a big issue. But we know certainly the younger generation and this new workforce is coming in, they're very much asking the question of what do I get to do after work? What's the quality of life like there? And so as far as where we play a role in that is creating those opportunities for those families to go out and enjoy the outdoors. With the inflation that we're seeing right now, things are getting more expensive to do. And so if you can take the family out and walk a trail, or you can have your kids go to summer camp during the day while you're working and do that for relatively inexpensive, or go out and hang out at Big Hollow all weekend and practically spend no money other than the gas it takes you to get up there. Having those recreation amenities, those quality of life amenities close to home, within minutes drive of where you live and where you work, I think that plays a huge role in the in a community's vitality. And we're seeing that across the state, these communities that are seeing the big influx of people coming in where their populations are growing. They're investing incredibly heavily in their quality of life amenities and their outdoor recreation opportunities. And so I think that's where certainly we play a role as the conservation department within the county.
Brian or Krista, anything you'd like to touch on? Okay.
Transportation is always a part of it. I mean, I mean, city and county both are constantly trying to do improvements, but also keep maintenance going. And it's a constant battle, but you know, folks do want good roads. And I think that's part of the challenge.
Next question, we'll go back to Chris Lee. And I think you've touched on a couple of things, but continuing to improve county parks is always a top priority. I don't know if you've got any updates or new information on some projects. I know you talked about building the new cabins down by the lake and some handicap accessibility. If you'd like to expand on that, maybe.
Yeah, so Big Hollow obviously is our big focus because it's our main park. It attracts the most visitors. And so we do have projects in the works. So next year, assuming we get through all the guidelines of getting this federal grant that we got squared away, we'll be adding campsites. We're gonna be doing some accessibility improvements. And then we've got a lot of other things kind of in the works that will come along as funding and grant opportunities make those available. But beyond that, we are looking at trying to expand our nature center offerings. So we get a lot of demand for summer camps, and every year it takes about 48 hours to fill 150 to 160 slots within our summer camps. So we're trying to find creative ways to offer those. And then we're always looking at offering other opportunities for folks to get out. We recognize that some folks aren't just going to take it upon themselves to just go out and explore a park, but if they can do it through some programmed way, whether it's through some of these hiker park programs that we've done to introduce folks from around here, and we've regionalized as well. So we've partnered with Lee County, Henry County, and Loiza County, and we're highlighting some of their parks. They're bringing people from their counties over into our parks. And so just trying to expand those offerings as well, and just connect folks with what outdoor recreation amenities are available in their backyard. And so it goes kind of beyond, you know, just big projects. Those are big and flashy and things like that. But there's a lot of kind of behind the scenes stuff, the little nuanced things to just try to connect more folks to the outdoors as we go along.
Thank you. Mental health is a top priority for our Chamber of Commerce members. What can the county do to improve access to a full spectrum mental health support for all in Southeast Iowa? Krista, maybe we'll start with you.
Okay. So mental health is definitely something that our community struggles with. I know that a lot of our mental health resources have regionalized. And so as public health, we provide resources for people who contact us, make sure that they are able to find providers or find the resources they need to get the help that they need. So that's one of the challenges that we try to be a resource for the community with.
Thank you. Tom, would you like to add anything on that?
You bet. Over the last decade, mental health services in Iowa have changed from a county-funded, county-provided services to county-funded, region-provided services when they regionalized the provision, and then Senate File 619 a year or two ago changed it from state-funded and region provided. So right now, counties are legal. It's illegal for us to expend any revenues on mental health services. It all has to, the state funds it. We can't provide that or provide any funding. And all those services have to be provided through the region. Des Moines County belongs to the SEAL, the Southeast Iowa Link region, which includes all adjoining counties. There's 8 counties in total. And I'm going to apologize in advance. With your permission, I'm going to take a little more time on this subject than the partnership probably planned. But I thought some of you might want to know how to help. The general perception is that mental health care is underfunded and largely unavailable. This narrative is not completely false, but it's not completely true either. Since 2014 and regionalization, there are more services available, and many of those services are available to anyone in need without regard to ability to pay. Some services are subject to eligibility. Burlington recently became the site of only the second intensive rehabilitative service home in the state. So there are services out there. This area's biggest problem is workforce. Des Moines County and all our adjoining counties belong to the Southeast Iowa Mental Health Regions, as I mentioned. I have a seat on the region governance board. We currently have RFPs, requests for proposals out for mobile crisis service. That's where if a law enforcement officer or somebody calls in, they send out somebody that a mental health professional that can be there within the hour. We have proposals out for community-based crisis stabilization adult services, and the same service for children. We have the budget to provide those services, and we're required to provide those services, but providers won't bid on it because there's no workforce. So a lot of people ask what they can do, so I'm going to stick my neck out. I'm going to tell you a couple of things you can do. Let your state legislators know that Medicaid reimbursement rates need to be increased to attract that workforce. They can do this. They created a brand new reimbursement rate to permit the creation of that intensive rehabilitation service home. They've mandated those for a couple of years or so, and nobody would create one because you can't provide the staffing it requires the previous rates. While you're talking to your legislator, ask them to support some incentives to build the mental health service workforce, maybe loan forgiveness or something like that. And I'm gonna stick my neck out just a little bit further, as long as it's out here. One more thing. There's a service called 23-hour hold and observation. Works like this. Let's say a law enforcement officer detains a nude individual standing in the middle of the street in 0-degree weather. He doesn't belong in jail, so the officer takes him to the emergency room. He probably won't see a mental health professional. He'll be released shortly, and the officer might find him back on the street in a few hours. If any of you ever talk to law enforcement officers, you know I'm not making this scenario up. But if there was a 23-hour hold and observation service available, the hospital could keep him for 23 hours, give him a chance to sober up, talk to somebody, maybe get referred to some additional mental health services, and the cop could go back to policing. Unfortunately, the nearest 23-hour hold and observation is in Ottumwa, which, as you might assume, is a little inconvenient. Most mental health and disability service providers don't have the resources and staffing to provide such a service. It needs to be a hospital. The SEAL region has approached Southeast Iowa Medical Center in West Burlington, but they don't seem to be interested. It's Medicaid funded, so it's not like they would be doing it for free. So if you happen to know a decision maker out there, it would be great if the hospital chose to offer that service.
Thank you, Tom.
You're welcome. Thank you.
Shane, anything you'd like to add to that?
Can you repeat that question, please?
Question is, mental health is a top priority for our Chamber of Commerce members. What can the county do to improve access to a full spectrum mental health support for all in Southeast Iowa?
Well, we can start to lean on our volunteers. I've said this before and I believe it. I believe we've got the best volunteers in the state of Iowa right here in Des Moines County. I saw a lady who went through some issues. She had lost a couple of kids in the process, dealing with mental health. But she received the help that she needed, and now she's here in the community and she makes a difference. I mean, I've talked to people that she has talked to, and it's not that, you know, she's getting paid to do this. This is something that she has a passion for because her life has been changed. So we need people whose lives have been changed to help change somebody else's first and foremost. And I do want to also say, because Tom brought that up about workforce being an issue, it's a problem. It is a problem, not just with mental health. It doesn't stop there, but that's huge because the doctors are starting to walk away because they don't like the reimbursement that Medicaid's given. So they've washed their hands of it. Even with the youth, with the early childhood, with the kids, that's where mental health starts. When you're just a little kid. I mean, if you get ruined at a young age, you know what happens. You know, it's hard. It's even harder to salvage that mental status. So that mental mindset. So with the early childhood, we can't find dentists. We cannot find, not for big stuff. I just want people to understand that. Not just for big stuff. You can't find a dentist for a cavity in Des Moines County. Because Medicaid, the doctors and the dentists, they're walking away from it. So it's a problem. It's a problem that we need to come together as a community regionally and figure out how we can address that. And Tom said, you know, maybe we can do some things. I'm cool with that. You know, if we need to bring in some people that'll work here and they say, hey, you know, you got 3 kids, your kids can go to Kenny Roller Ranch for free. They can go out to Fun City for free. You know, I don't know what we have to do to enhance that, but I think we need to look into those things and flip over tables because the kids are getting left out. And if the kids get left out from the very beginning, man, we've got problems coming down the road. And if you think mental health is in a bad state now, it's going to get even worse if we don't hijack this situation and deal with the kids at home. Because if they're not stable at home, if they don't, am I going too long? No, I'm not. I was gonna say if you have a stable home, we all know how that works. If you have stability in the home, that's good for your mental health. It's going to get the kids going to school and they're not going to be stressed out, things like that. They get a good education, they can give back to this community. So I just think we need to make sure as we're looking at mental health, we need to go back to the core of it. We need to deal with the families and the young kids because it's a problem. And the problem is, as Tom said, getting staff to come to Des Moines County and to commit to stay here. We're gonna have to look at other ways to try to get to make that happen. Sorry.
Thanks, Shane. Next question for you, Krista. And you've touched on some of it, but maybe you can expound on the plans that are underway for the new public health facility. What can you share regarding the project as far as location, size, budget?
So the last 2 years during the pandemic really highlighted some of the challenges our public health building has. Obviously, the location that we're currently at has limited parking, and if you come to visit our public health, you'll know that we have limited waiting room space. So bringing people in, and during the COVID pandemic, everyone was supposed to stay 6 feet away from each other. Our waiting room allowed for 3 to 4 people to be in that area. So something we're really focusing on is making that a good resource for the community with the new public health building. So the location is going to be at the corner of Agency and Curran Street, the site of the old Washington School. A great location. It's going to allow for extra parking, handicap accessibility. We're looking towards the parking spaces for the handicapped parking to be closer to the building, and hope that we're going to have a kind of a drive-through area. Should we ever be challenged with another pandemic, or as this pandemic isn't completely over at this point, should we need to give more COVID vaccines or influenza vaccines, we can offer that through a drive-through and make that more accessible for people. So those are some of the things that we're really looking at and looking towards the future as to how public health continues to grow and the services that we can continue to provide for the community. So really anticipating that as we put the building the plans together.
Sounds great. Anybody else? Tom or Shane?
Yeah. We're currently in the schematic plan design. The design team with input from the county has a schematic design. The construction manager, Carly Nelson, is putting a budget cost on the schematic design. Once the budget and the design are reconciled, they'll go into the design phase. And then they'll produce construction documents, so it's probably 5 months later. We go out for bid, but short answer, within a little luck, we hope to move in, or we hope to have the facility done in spring, summer of 2024.
Thank you.
I really didn't have much written down on that question, except for, I want to stay within the $3.5 million, that we initially, mentioned, soft cost included. But I do want to say it is in a great location. I do love the fact that there is going to be a drive-through. But I still, whenever asked about that, is Krista looking at me? Whenever asked about that, I've got the same answer I've had from Jumpstart. I want them to have it. I want them to have everything that they need in there for $3.5 million all in. That's where I'm at. So I have to get funky. It's not just about the money on this one. It's a lot about money with me. So I think we're going to get everything we need, though. I do.
Krista, we're going to come back to you with this question as well. As we go into the winter months, what tips can you share for a happy and healthy season?
Absolutely. So we've already seen upper respiratory infections. I think we've all heard about the RSV. Next month, we're getting into the peak influenza season. So that'll be from December to February. And we are still seeing some COVID. So I really recommend people get their vaccines. We offer the flu vaccine. We offer the COVID vaccine. And you can get both of those vaccines on the same day. So that's definitely something preventative. The other thing is we really educate people on good hand washing this time of the year. Stay home when you're sick. The best thing we can do is prevention. There are challenges with these upper respiratories. Some people get mildly ill and some people get very sick. So that is definitely a challenge for them. One thing I do recommend, and we hear people call us a lot and say, well, so I have COVID, do we still need to isolate? And there is still recommendations from the CDC for isolation. So if you test positive for COVID, it is still recommended to stay home for 5 days and isolate. And once your symptoms improve and your temperature is gone without temperature or fever reducing medications, then you're able to go back out in public. But the recommendation is still to wear a mask for 5 days after your 5 days is done. So through the 10 days, but encourage people to do that because we are seeing little outbreaks in different areas. We currently don't do contact tracing, but if we see areas where we're either seeing an upper respiratory influenza outbreak or small group of people that are having that, we do contact tracing and let people know that they've been exposed.
Thank you. We'll start with you, Shane, and work down the line on this question. Keeping a balanced budget is key for community financial health. Please share how each community is balancing the needs of the citizens with the realities of the budget.
I'll be honest with you. I didn't even know how to answer that question. I called Rachel and she wouldn't call me back, but this is how I'll answer it. Each community is trying to operate within their budget. That's where we're at. It's budget season, just like every family is trying to operate within their budget. And when you're trying to do that, you have to prioritize. And so I don't know if this answer you want, this answer you're getting, but it comes down to that priority. I'll make this quick, but I have 3 kids. I have a diabetic. I have a single mother, and then I have a dad who's got a job. He's married, all that stuff. Well, my priority is the diabetic. She's priority 1. I don't love my kids any different. I love them all the same, but there's priority when it comes according to need. And I see the priorities being safety, roads, and health, and Des Moines County. We need safety. That's a priority because people have to feel safe here. You say, how do we get people to come here? Well, we have to know that if they come here, they're going to feel safe. We have to have good roads. That's why BC gets his money every year, his allotment, because he does really well with it. And they have to have good roads so that they can get to where they're going. And then we have to deal with the health, mental and physical. And that's also why CP is getting her money because they have to be healthy in this area. So those are priorities that I think every community is working off of the same guidelines as far as Des Moines County. And Tom brought up there's certain things that aren't even within our wheelhouse. All we can do is give a good assist. And how can we give that good assist? By keeping a low tax levy, by making sure that we're taking care of the the offerings that we have within Des Moines County that are within the confines that are set up and established. But I would just say prioritize, prioritize, prioritize. And when it comes down to that, when there's nothing else, the top and bottom line is quality of life.
Which goes right into Chris, quality of life.
Yeah, so.
I wasn't done.
Thanks for that segue.
I wasn't finished, but all.
You're cut off.
I had more, but.
So yeah, as I've noted before, we are very focused on quality of life and what it means to live here and visit here in Des Moines County. For us, there's really kind of two elements to balancing this, and one is understanding what the citizens and the visitors to this county are really looking for. And so we try to do various survey mechanisms. We interact with a lot of people that visit our parks. We're constantly trying to collect park feedback surveys, and then our staff is always out there interfacing with folks. We do post-event feedback forms and things like that, just trying to really understand what it is that folks are looking for from their county park system, from the conservation department, and then weighing that against the realities of budgets. And then as far as project-based type stuff, we bring a lot of money from outside. So we bring in a lot of grants, we bring in a lot of donations. And so continuing to do that, but then also we're always playing the long game here. And we recognize that what we do today and the plans and programs we put in place today are affecting generations from now. And nothing happens overnight. And I think it's important for us to paint a vision of where we want to go as a park system, as a conservation department, and then know that it isn't going to happen with the snap of a finger. We've got these big dreams of building cabins right on the lakefront of Big Hollow. I don't know when or if that'll ever happen, but there's a lot of folks that see that and say, wow, that would be an amazing asset to have in our backyard. I talk to folks from out of town and say, I would spend money to come stay in that with my family. It might not happen anytime soon, but having that there and having some folks be excited about what could be from our park system, I think is important, because that paints a picture of we're not just the same old Des Moines County tomorrow that we are today. We're going to be better. We're going to improve. This is going to be a better place to live. And when my kids, who are very young, 7 and 4, graduate from college, or if they decide to go to college, something that's going to bring them back. I want to create the type of place that folks are going to want to come back to after they leave here to go get their education, come back and fill these jobs. I want to create the type of place that grandparents are looking forward to spending weekends with their grandkids as they kind of, age out of the real active stuff. Maybe they could just rent the cabin and still be there, and the kids can go run the trails. So we're really playing the long game here. And we recognize that nothing happens overnight, but sometimes it does. Sometimes you paint this picture of where you want to be, and somebody walks up and says, here, let me write you a check, because that is exciting and I want to be part of that. And so that's kind of the approach we take. And looking at it from the perspective of we're not just a single entity. We are part of the bigger overall economic development, quality of life in this community as a whole.
Thank you, Chris. Tom?
Balancing the needs of the citizens with the realities of the budget. I couldn't agree more. One of Des Moines County's annual priorities is always and exactly that, maintaining and improving first-rate services while keeping downward pressure on the levy. On behalf of all the folks at Des Moines County, I'm going to brag a little bit. In recent years, both the sheriff's office and the jail have added additional personnel and state-of-the-art equipment. Secondary Roads has added a program to assure every gravel road gets new gravel at least every other year. Every county bridge is professionally inspected at least every other year. Paved road bridges are always replaced before they need to be weight restricted. All county offices have energy efficient updates. We're building a new modern public health facility. We own conservation, $250,000 for Big Hollow improvements, and gave them all of the general fund revenues from the parks. The county took over 100% of DESCOM funding. The county did all of that and a whole lot more while cutting the county's property tax levy 22%. From $8.74 to $6.82. I think we're balancing those things best we can.
Thank you. Appreciate it. Brian?
I'm not sure how to follow that. But,
You should have dropped the mic when you got done, Tom. I'll show you how to do that next time.
Totally picked the wrong seat. But I'm gonna go big picture. I mean, I've been employed at Des Moines County longer than anybody here, I think. I think you can't control a budget. You can't give the citizens what they want without having a group effort. And I look around and between elected officials and department heads, I think we've had good groups. I think we might have the best group we've ever had. And every one of those has their own budget. They and every one of those, I think, from what I can think of, live in Des Moines County, pay taxes in Des Moines County, have an interest in Des Moines County, and they want to see those things balanced. In my department, unfortunately, sometimes that's deciding between a no and a yes on what you're going to do. And I think we all face that. You know, I think that's been mentioned. And those are all tough decisions. I think we all face that in government if you are trying to keep your taxes down. And I think that's very important also. So it's a group effort. And I think in the end, I think we walk away, all of us walk away fairly proud with what we've done, and also maybe frustrated and challenged to see how we're going to do what we couldn't do that time around, kind of like Chris mentioned. So that's all. I'll quit rambling now. So good luck with Paul and Tom.
So public health has been challenged the last 2 years with COVID, and we were very lucky to have a very supportive elected officials as well as the community and community partners and our volunteers. We did a lot of COVID clinics, vaccine clinics. I think some of you may remember what we did down at the Memorial Auditorium. And that was all due to the help of the people of the community. Everyone was very patient when they came down. We had volunteers that came out. Whenever we called anyone in the community, said we needed help, they were willing to help with that. So public health had a challenge, and the community really stood up and helped us with that. And so very much appreciate that. The funding, we've gotten some extra COVID funding from the state, as well as, again, our elected officials. When we had needs, they were there to support us and really help us keep the community safe.
Thank you. Rachel, do we have any questions from the audience?
I have a comment. Not to do with you, but in the crowd here, doesn't need to be on Saturday or Friday. My comment.
I have a question. The auditor position will be open by the end of the year. What is the plan to fill that position?
We won't appoint an auditor. Well, I'll tell you what, there's a legal, I think the position has, or not the position, I think it has to be announced that the board plans to appoint an auditor. It has to be published, and I'm sure there's a timeline there. If whether it's a petition or somebody wants to call for an election, that's possible. I apologize, I do not know the exact that for right now the plan is to appoint a replacement, because I believe her Terry's resignation is effective December 31st.
I would ask the local option sales tax home rule question. Last year in the state legislature, there was a conversation about the state taking over control and access to local option sales tax, which from the local government perspective seems to go against the wishes of the constituents that voted for local option sales tax, right? That issue probably will come back up in the state legislature in this session in January. What are your thoughts on my perception of overreach of the state legislature into local government and the concept of home rule?
Right, Tom.
Okay, home rule, as I understand it, I think it was a constitutional amendment that basically said counties and cities can do whatever, anything they think is for the good of the population, the good of their locality, their jurisdiction, as long as it doesn't overlap and contradict something that the state does. So, and counties can't do anything to overlap the incorporated cities. So if the city has a rule, your rule stands before the counties. But yeah, I agree. They do this periodically. They recently did it with the ATV ordinance. They decided they could come up with a better ATV ordinance that Des Moines County does. And I thought that was a little bit of a stretch into home rule. And what you're describing, the county, the same thing. When it was voted on, we said, this is what we're going to do. 50% of those taxes go to secondary roads, 20% of them go to rural services, 10% to economic development, 10% to the sheriff, and 10% to the county attorney. I think that's right. And the citizens of Des Moines County decided that. That's where they wanted those, that they were willing to impose that tax, and that's how they wanted it, where they wanted it to go. So just because the state sees an extra pot of money, I've been here long enough, I've seen the states divert several income streams from local government to the state. So yeah, I agree with you. I think that's a violation of home rule.
I would just add to that, that I haven't seen true home rule in effect yet. There's always overreach from the federal government and from the state in some way, shape or form. And I'd like to see a little bit more of a fight back on that so that we can have a little bit more autonomy and make the decisions and not have to worry about, having somebody above our heads coming back and changing what we want to do. So I don't know if there's a community out there in the United States that operates under 100% home rule. Well, we know there isn't one, but we still have to fight for that because we're a unique community and we have to fight for our unique needs.
And I think it is, I'm almost positive it's a constitutional amendment, so it is in the Iowa Constitution.
It is.
Okay.
Thank you. Excellent question. Any other questions? Well, I want to thank the Des Moines County Leadership Group for participating here today. Please mark your calendars for the next Friday forum on Friday, December 16th at 8 a.m. Thank you.
Thank you.
Thank you.